Mhm.
Hi, good evening, everybody. Welcome back. We didn't have many webinars last month. I took a break. I was in Europe, and so was Naeem. Actually, Naeem went to take his exam, but we didn't manage to meet up in London. Naeem is actually very interested in emergency medicine. He's taking his fellowship in emergency medicine, and I can see from Facebook. I'm meeting Naeem for the first time here. But I've been following his Facebook, and I see he's an influencer of some sort. He's got a lot of followers, a lot of likes, a lot of comments on his Facebook updates, making me a bit jealous. But more so, I'm very interested in diving. I started diving in 2019, and then after which pandemic hit us, so I have not clocked in much. But I've in the short duration following last year when we opened up, I have now signed up for my dive master course. So I've also done cave diving, which is the introduction. And so that's why I was very keen to bring in Naeem to learn more about diving emergency. So Naeem, we go ahead.
Yeah. Thank you, Dr. Betty, for the kind introduction. Just let me share my slides. You can see the full screen, right?
Yes, we can see the full screen.
Right. Thank you, Dr. Betty, for inviting me
Just call me
again.
Betty will do.
Right. So basically, just some disclaimer. I'm attached to a few organizations. I have a special interest in wilderness medicine, but just as a disclaimer, I have some experience in treating underwater emergencies, but I'm not a dive physician. So what I'm going to share today is more of something towards a very basic knowledge about the underwater emergencies. But if you have something that you need clarification, just feel free to type in chat box or raise your hands to ask questions. Before we proceed, just allow me to take this one moment to congratulate my friends, Roy Han. So he's now is the deepest diver in Malaysia. So end of the May, he did 164 meters deep dive in Sipadan Islands. That's a pretty interesting experience. But unfortunately, I'm not going to cover on deep dive in my talk today. Because it's a very technical topic, I do not want to confuse you guys with the talk for today. Right. So basically, the first thing that I would like to share with you is that before we go further on the underwater emergencies, first we should try to understand that there are differences of the type of underwater activities. The first one is the free diving. The second one is the recreational diving, and the third one is the technical diving. Basically, if we look at the broader classification, some even included commercial diving, and also search and rescue as part of the classification. But for the purpose of this talk, I'm just listing these three types of underwater activities. Why I put it here, because it's that the mechanism of injuries are slightly different. For example, like free diving, we also call it as breath holding activities. So most of the time, the injuries that we see in the patient is more of towards related to the hypoxia, and also the shallow water blackout, because they basically need to hyperventilate before they hold the breath, and followed by diving. And the second thing is that the recreational diving, it is what most of us do now. The limit is 40 meters. And the last one is technical diving, in which that you need to learn something else. It is basically something that is beyond the recreational diving. So technical diving can be both commercial and non-commercial. And for the non-commercial part, it is usually they did it for hobbies or fun. It could be using the mixture of gas in order to allow them to go deeper and to dive for a longer duration of times. And also, just to introduce you to some of the things that you are using. In diving, we have what we call as surface supply, or the horse diving, as you look at the pictures on the left. So in Sabah, we have a group of fishermen that are going to catch lobsters. So they use this a very long hose pipe that is connected to compressor that is usually on the boat. So they can go quite deep, 18 to 20 meters, and they tend to stay longer underwater, sometimes up to 1.5 hours in order to catch fish. So we have few incidents related to these traditional fishermen, and last few years we even have one mortality due to the type 2 DCS related to the surface diving. Yeah. But another commercial application for the surface diving, we can see that nowadays there's a lot of they call it as a sea walker. They use this helmet connected to the compressor on the boats. I'm not sure regarding the regulation in Malaysia, but we do have actually the international standards of what are the criteria needed in order for you to run the business. But it's available, I think, at many places. In Sabah, we also have few operators that offer these services. And then when we talk about scuba, the definition is self-contained underwater breathing apparatus. So usually you will have the regulator that is connected to your tank. And for the scuba, usually we have what we call as the closed circuit and also the open circuit. So in the middle is just something to show you the picture of the closed circuit. So in this type of diving, they will usually recycle the gas in which that we will breathe the same gas over the time. And meanwhile, for the open circuits, that is what most of the recreational diver will use. Right. Actually, diving, if we truly want to learn about dive medicine, it's quite technical. It involves a lot of physics. It will involve a lot of needs a deep understanding about the gas. But what I want to introduce to you today is the Boyle's law, because it plays a very important thing in managing diving emergencies. So you need to understand that in the Boyle's law, it is stated that given a constant temperature, the volume of a gas decreases at the same rate surrounding the pressure increases. So meaning that when we go diving, for every 10 meters that we go, the pressure, it increases for 1 atmosphere. So basically at 0, which is at the surface, it is about 1 atmosphere. So as we go deeper, the pressure will be increases. As a result, the volume will usually go down. So the same thing will go to our lungs, right? So just remember that our lungs are filled with a lot of spaces for the gases. So as we go deeper, imagine that on the surface, we have our lungs are able to accommodate 6 liters of air. So when we go to the 40 meter depth, the size of the lung is only about 1.2 liter. So that explains one of the reasons why when we go deeper, we find out that sometimes it's a little bit more difficult to breathe, and the way that we consume air is more, and we can't really spend much time at a very deeper depth. From this gas law, the things that I want to introduce to you today is the dysbarism. So basically, it's any adverse medical condition resulting from the changes in the ambient pressure. So these changes in pressure must occur either at a rate or duration exceeding the capacity of body to adapt safely. So I will explain about the DCS later on. Just bear with me for this some terminologies. Other laws are also important. Delta law basically more important for those who are doing the diving using the mix of gas. But basically, it's just to mention that the total pressure of mixture of gas is equal to the sum of the pressure of each individual gas component in that gas mixture. So it's not really relevant for a normal diving. Right. So when we talk about the diving emergencies, to be honest, that we do not really have a way to confirm regarding that particular cases of death involving diving as due to what result or what result. So most of the time, the final cause of death will be given as a drowning.
I
So
see.
this, yeah. So basically, this is a common things that occur. But if we look closer of the root cause analysis of why a diving death occur, usually that there must be some trigger. For example, like the driver start having out of air. So this condition force them to do the emergency ascent. And this emergency ascent will trigger the air embolism, leading to the either is a gas embolism or DCS. But most of the time, gas embolism is the one that cause a rapid fatalities. So at the end, cause them to be drowning. And then another example of the root cause actually that the divers they get trapped in between the structures or entangled by the free ropes in the underwater. So that entrapment caused them to be out of air, leading to the asphyxia and finally drowning. So meaning that what are being considered as drowning, they may have a different triggers and mechanism of how it causing the diving death. So when we talk about the diving emergencies, we need to understand that the phases that a diver need to go through while doing the diving activities. So if you noted in my slides, let me try to get a pointer. Right, can you see my pointer now?
Yes, can.
Right, so basically most of the time the diver will spend their time on the surface on the boat, right? So after that they will descending. So descend means they are trying to get into the depth. So you need to understand, as I mentioned before, as we go deeper, the pressure will increase. So that's why most of the time, the problem that the diver may face during this time is something related to the pressure changes, which is the squeeze and also the nasal bleeding. Squeeze is basically when the pressure start to push the structure in your body that have cavities. For example, your ears, your tooth, and your sinus. So once you dive, you will stay at your bottom. So at the bottom, it depends on how many times that you spend there. But problems that can occur, including, for example, like nitrogen narcosis. This barism is especially that if you are holding your breath and you do not have a good buoyancy. Sometimes we call it as a yo-yo dive profile, meaning that you go up and you go down, keep on doing up and down. So, and sometimes that patient may get carbon monoxide poisoning as a result from the contaminated air. Right. So after
Contaminated air from the gas tank.
compressor, from the compressor, yeah. So meaning that when we diving, we using the tank. Many people mistaken that they think that they are breathing using the pure air, but it is actually just a normal air that we dive, that we breathe, but it is been compressed. So in order to do that, there is a compressor that we use to fill up the tank. But sometimes that if they did not regularly service the compressor, they did not change the filter, so they can cause a contamination to the air. So this resulting in the poisoning, especially the carbon monoxide. Right. So after they spend time at the bottom, they will face that they will start to ascending. So basically during the ascent, it basically depends on how deep you are and how fast you ascend. So usually if you are wearing a dive com during the ascent, usually if you are ascending too fast, your dive com usually will give you a signal that you are diving, you are ascending too fast. So the things that you need to follow a safe ascending rates, and after that, it should be followed by a safety stop. So as I mentioned earlier, so if you ascend too fast, the change in the pressure that occur very fast will cause you the this barism and also the decompression illness. And after you ascend, basically things can go wrong on the surface as well. For example, like if you did not follow the safety procedures as instructed, patient may have a boat accidents, they can have a drowning, hypoxic blackout, and also the marine envenomation. So then the diver, they will spend their time at the surface while waiting for the next diving. So post diving, they might have the decompression sickness, arterial gas embolism. But please bear in mind also, sometimes diving emergency might also be cause of other problems like the exacerbation of medical problems. So that is been triggered by the environment. For example, that you might have asthma, and when you go dive, the water is too cold, it triggers the asthma, or you have any medical condition that may predispose you to get spontaneous pneumothorax. So sometimes all these things can cause a mimicry for the diving emergencies.
Can you explain more what is marine
Envenomation, yeah. So I will explain in my next slide.
Okay, fine.
But yeah.
Thanks.
Right. Just to highlight regarding the bubbles problems, right? So as I mentioned to you, the problems with the bubbles, when we go deeper, the bubbles will actually, for example, the inert gas like the nitrogen, it get very small so that it can diffuse through the capillaries. So it can enter your tissue, it can enter your joint space, it can enter your venous circulation as well. But when you go up, the pressure will be lesser and that bubbles will start to become big again. So that will cause a problems to your body. There are two types of conditions that we usually try to separate things, which is the arterial gas embolism, and the second thing is decompression sickness. But the basic behind these two conditions is the same. It's because of the pressure changes causing the size of the bubbles increases. Usually in the gas embolism, if you look at my pointers, so remember that when we go up immediately or very rapidly ascend, it will cause a trauma or barotrauma, or what we call as pulmonary overinflation syndromes. So this will actually cause some ruptures in the alveoli, and then the gas is then being forced to go into the pulmonary vasculature, which is later being distributed systematically. And if the gas happen to be a very big, it can cause problems, including the strokes and also the circulatory arrest as well. What differentiate AGA and DCS is that most of the time, the AGE, they tend to develop faster, which is during or immediately after surfacing, which explain that the bubbles occur in the artery. Meanwhile, usually for the DCS, although it may occur during the ascent or after the surface, but majority of the cases, the DCS develops 1 hour after surfacing. Right. So in DCS, we divided into type 1 and type 2. Type 1 is basically just a milder form of DCS, it can cause you just some numbness or non-specific pains over your body or the joints. Just to share with you, sometimes that when you go diving, sometimes it is normal for you to have nitrogen in your body. So that's why we have the surface interval. We have those no flying limits. That because it is one to give time for the bubbles to be taken out slowly from our bodies. Meanwhile, for the type 2 DCS, this one is a more severe form that usually involve the spinal cord and also the brains. That patient may have weakness, they have neuropathy, and they may have stroke-like features. Right. But sometimes it's very difficult to differentiate whether this is a true DCS, because sometimes it can be a mimicry. Because sometimes the patient may presenting as a body weakness, but they may actually have the hemorrhagic strokes. And sometimes that this patient, they have can develop a massive hemothorax. One of our patients previously, he came to emergency department after 1 or 2 days after diving with shortness of breath. So on examination, we found out that he has hemothorax. So insert the chest tube. So he developed a massive hemothorax at that time. Together with the pneumothorax, initially we think that it might be due to diving related incidents. But because of the onset, it's kind of like pretty big rare for it to happen. And the CTA dump at that time is that the patient was just like unlucky because he have a rupture of the vessel at the tip of pneumothorax points. But these things may cause what we call as mimicry that is sometimes difficult to differentiate. But with a good history taking and also physical examination, and we can actually, with early consultation with the dive physician, we may detect the mimicry. And another scenario that I would like to share with you is that although that DCS is commonly occur like 1 hour after the incident, and it's more usually occur because of the pressure, because patient went into a deep dive, then surface quite easy, quite fast. Sometimes DCS also can presented after the shallow water diving. Even we have cases last time that was attended by my colleague. That was not in my hospital, but it is in USM. Is I'm not mistaken. We were discussing about this case. That the depth was very shallow, it's about 10 meters. But after that, patient went to take a flight. And then after that, the symptom was exaggerated by that conditions. And sometimes also, although that it is very rare, delay onset decompression sickness may also occur after 24 hours of incidence. So I think that the message that I want to highlight here is that it is okay for you to not really sure what is going on, but the things that for you to refer early to dive physicians. Right. If I talk too fast, just stop me and ask me. Right.
How many people are divers here? Put a comment on the chat box. How many people dive among all of you who's watching? Oh, anyone? Okay, we can continue first while we wait for the answer.
Right. Okay. All right. So previously I explained regarding the DCS, arterial gas embolism, and etc. But surprisingly, if you look at the inventory of the analysis of the diving emergency cases, you will be surprised that most of the diving emergency actually occur at the water surface. And surprisingly, many patients, they did not descend at all. So the incidents that occur, including trauma, especially being hit by the boats, or sometimes it can be caused by the cardiac complication as well. for example, like sustaining the cardiac arrest while on the water. So we need to bear in mind that for all diving emergencies, we need to treat it as a high impact or high velocity trauma. So C-spine protection is a must following a diving emergencies until that cervical injury being clear. Right. All right. So for those who went to a diving training to take their open water certificates, and it's been stressed, especially during the rescue diving. These are the things that your instructor may repeatedly tell you that panic diver is basically a time bomb. That if you see a diver that is struggling and they seem to be panicked, it is considered as a warning sign, because not only the diver is himself can sustain injuries, but if you try to rescue them, they will also can drag you down, and both of you can actually go into drowning. So the tip is that if you want to help, make sure that you are being trained to help with the panic diver. If possible, try to not to get into the water at all. You can throw anything, buoyants, you can throw ropes for the divers, or using a pedals to pull them. But if you really need to go in the water, make sure that you are a trained rescue diver. You need to approach them from the back and not from the in front. If not, they will grab you and both of you will drown. Right. So next, we go to the tips number 6. When we manage patient with suspected drowning, when we try to rescue the patients, right? The things that we need to look for is to look whether the mouthpiece is still inside the patient mouth or not.
The
While they are
regulator?
the regulator, yes. While they are underwater, and the next thing is to see whether there's a bubbles coming out or not. So when you approach the patient underwater, sometimes they may appear like not really conscious, but they are still breathing. But then if the regulator are outside the mouth, and then there are no bubbles coming out, so most of the time that they are already in the respiratory or cardiac arrest. So basically, the prognosis of the drowned victims, it depends on few things. For example, the water coolness, the submersion times, and also the age, in which that those who are young have a better prognosis. So the problem with our water in Malaysia is that our water are not cold enough. So most of the time that if the patient drown for more than 30 minutes, it is always associated with poor prognosis. So usually it's very not common for you to discharge this kind of patient with intact neurological outcomes. But sometimes that it is not easy to determine the arrest time in diving emergencies. But I think that the best is just try to do the best that we can do. Right. These are the tips. Number 7 is that people love to debate regarding that the hypothermia in the tropical country, especially Malaysia. Even now we have a very hot temperatures because of the high humidities. Although it's like 37 degrees, it feels like 40 degrees, right? But the thing is that hypothermia may also develop in our country, especially while we are dealing with patients with diving emergencies. We just need to bear in mind that the water temperature, the humidity, the effect of wine or of the wind, they can actually predispose the patient to have hypothermia. So this is also particularly true for those who are suffer from trauma or with the cardiac arrest. So that's why when you are rescuing victims of diving emergencies, if they are wearing the wetsuit, try not to remove the wetsuit, because the wetsuit, they have actually the water surrounding them that act as a barrier that prevent the heat loss.
But
And
wait, hold on. Can I ask you? Just now you said that if the water is colder, the prognosis is better.
yes, something to do with the neuroprotection effect of the cold water.
And
But
yet hypothermia can occur. Right. or not?
yes, especially right. So this is different points. So
Okay.
what I'm discussing for the earlier things is that regarding patient who drown, regarding the prognosis, drowning patient, the prognosis actually depends on the type of the water, right?
See, okay. So this is another point where it's another problem that can occur, and it
Yes,
can also occur in tropical country. Okay.
yes. So I just would like to emphasize that
Yes.
although hypothermia,
Yes.
it is not common in tropical countries,
Yes.
but it can still happen, especially that if it involves the trauma patient or those who have tendency to lose the heat faster.
Yeah.
Yeah,
I understand. So
right.
let me wait, hold on for a while, because we have some people who are divers who has come into this forum, and they have asked us what is prognosis. So prognosis is actually what is the chances of a patient surviving from the problem and illness. Okay, means like, let's say you have cancer. There are cancers with good prognosis and there are cancers with bad prognosis. Bad prognosis means your chances of dying is earlier and higher. Good prognosis means even though you have the cancer, once treated, you may live for a long time. So that's the meaning of prognosis. Okay, go on.
Right. Right. So the tips number 8 is that when you are dealing with patient with a diving emergencies, always treat them with the oxygens. And I think that the problems with our diving industry, not all boats that go for diving trips, they don't carry oxygen. So I can guarantee you that if let's say that we take the 100%, maybe less than 5% of the dive operator will bring oxygen in their boats.
Yes, they will leave
Yeah.
it at the center.
Yeah. So that's the problem. So I think that it is time that for us to start a campaign in which that maybe that each boat they need to bring oxygen.
Yes.
Yeah. So sometimes using oxygens are very tricky, because sometimes that especially for those who are diving in certain conditions, sometimes they may have the seizure because of the oxygen toxicity, etc. But sometimes that's one is quite difficult for you to prove while you are at the site. So as the safety advice is that regardless of the causes, for any diving emergencies, give them oxygens.
But
And
oxygen at the sea level
right,
is not a problem, right?
yeah.
Treated,
Right. So as I told you before, right,
uh-huh.
for example, like if you are having the DCS or arterial gas embolism, right, because of the bubble is too big, sometimes that it will affect your oxygen transport in your body. But when you give oxygens, pure oxygens, it do few things. For example, that highly concentrated oxygens, it will help to displace the nitrogen bubbles, and at the same time, it will also try to correct the hypoxia, and it also works by what we call as a passive oxygenation. So it will still, although it is not much, it's very little actually, but some of the oxygen will still go to through your plasma. Right. Sorry, just give me 1 second.
Yeah, no worries. We will take questions if there's any questions. But basically, both DCI and also pulmonary embolism or embolism is treated with high concentration oxygen in any diving emergencies, right?
Yeah, in all diving emergencies, regardless of the cost, we treat as with the pure oxygen first.
Yeah, until we can get into the decompression chambers, right?
Yes. Right. I think this has caused a lot of debates, especially when we talk about the patient with cardiac arrest. Some people they want to do the CAB, some people they want to do ABC. But just to let you know that if the patient suffered from cardiac arrest, for diving emergencies, we always prioritize the AB before the C. And in approaching divers who are having cardiac arrest, that we give 5 initial rescue breath first before followed with the normal cardiac arrest algorithm. But if you look at the AHA they are suggesting to give 2 initial rescue breath. But for me, because I'm from the background of the diving, so I will go with the suggestion to use the 5 initial breath for the patient with the cardiac arrest after the diving emergencies.
Oh,
Right. And when you have this such patient come to your emergency department in respiratory distress, and then if you at that time if the patient is still alive, do not delay intubation if required. But in certain cases, it might be appropriate to start the NIV or also high flow nasal cannula. So I think the intubation is a clinical judgment based on what you are facing during that time. But the thing is that do not afraid to intubate a patient. For me, if you ask my personal opinion, if patient come in a respiratory distress after the diving, I would rather intubate them early rather than waiting for them to develop the cardiac arrest later. Because managing the airway and also breathing is extremely important in diving emergencies. Okay, right. So just now you were asked about the marine envenomations, right?
yes, yes.
Right. So basically, the injuries related to animal bites, stings are not
Okay.
really common as what we think. But there are also animals, especially the jellyfish, that cause significant problems while diving. But since most of us are divers, I think that we need to remember that we always remember that the first things that our instructor teach us was that never touch anything under the water, right? So most of the times, the marine animals they are harmless, except that for certain condition, like for example, for certain type of shark, like tiger shark, they can get very aggressive, especially during the breeding season. The same thing goes with the if you notice about the trigger fish, especially if you dive on top of their nest, and at that time it was breeding season, the trigger fish will definitely will go and attack you. But the injuries usually not that severe. Um, there there are the extreme cases of that things, but it is not really that common. And the thing is that when dealing with the marine animal envenomation, so basically, envenomation is that certain animal in the water, they have a specialized venom gland. So the process of injecting the venom inside the human body, it is called as envenomation. And yeah, and then lucky enough, most of the toxin in marine envenomation, they are can be distracted by heat. So most of the times, any injuries, for example, like if you have been stung by the crown of thorns, sea urchin, spiny fish, the trick is that to use the hot water immersions. So you can just but you need to have a temperature of 40 to 45 degrees Celsius, and then you need to submerge your affected limbs for 20 minutes.
I
But
see.
yeah, but sometimes it's quite tricky also, because if we look at this logically, right, who wants to bring hot water under the hot sun while
Yeah.
diving? We all been looking for the cold water. But if you happen to be stung by those creatures, if you do not have the hot water, you can always take your Energesia, simple Energesia, your paracetamol, your Brufen, and get back to the beach immediately. And do the hot water immersion by the beach side. And another thing is that one thing that I will teach you today is that how to do what we call as a pressure bandage immobilization, especially for the neurotoxic envenomations, especially for the sea snakes and also the blue ring octopus. These injuries, just to tell you, I'm worried some of you may get confused. I'm not touching about the poisonous animal, right?
Okay.
So there are also poisonous animals like those pufferfish that can cause the tetrodotoxin poisoning. But the difference between poisoning and also envenomation is that envenomation meaning that you need to have a set of venom gland and also the tube, and they need to have stingers to actually deliver the venom into your body. So that's the envenomation. Meanwhile, for poisoning, it is when you are exposed to the toxin, either whether by eating it, smelling it, ingesting it, in order for it to cause the
I
harmful
see.
effect to
I
your body.
see. I
Yeah.
see. Okay.
So what I'm touching here is just something to do with the mechanical injuries or envenomation from
Okay.
the marine animals. Right. Um, right. And the last thing is that mechanical injuries also occur, but not common. So if you remember that so many years back, we have the crocodile hunter that was actually died because of the penetrating heart injuries from the stingrays.
Oh, you mean that Steve guy?
Yeah, Steve Irwin.
Yeah, Steve.
So yeah, it occurs but not common. Um,
He was very unlucky, huh?
yeah, yeah, that's true. So I just showing you the pictures of the pressure bandage immobilization. But remember that you only do this for if you have been stung by a sea snake, sea kraits, or blue ring octopus or con snail. But don't do it in other injuries like jellyfish or anything that cause significant swelling, because it will worsen your condition.
Okay.
So you basically need your elastic bandage for you to do it. So right, I think I lost my pen. Let me get. All right. So in these pictures, so when there's a wound there, you can just cover with anything, gauze or anything, and start to roll the bandage, the elastic bandage, from the distal to the ups. So when you do the bandaging, you can just overlap the bandage. Some do the figure of eight technique. For me, it don't really matter. So you bandage all away until your elbow joints, but make sure that it is not too tight until it is constricting your blood vessels. And after that, you can just put any splints and then immobilize, then go to the hospital immediately. Right. The next thing is that if you go for a diving trip in your first aid,
Okay.
bring
This vinegar is what kind of vinegar? Any vinegar?
yeah, anything in your home. So you just don't leave it in your kitchen. Just bring it with your that during your diving trips.
Okay, I will.
Yeah, so the thing is that especially that in certain part of Sabah and also in Tioman, there will be a season of a jellyfish. We have cases of diver being stung by jellyfish. Or so what the vinegar do actually, please do not get confused. Vinegar did not treat the jellyfish stings, but the vinegar is just a method of first aid treatments for box jellyfish only. So jellyfish, we have so many types of jellyfish. But basically vinegar, it only works for the box jellyfish stings. But because sometimes it is very difficult for diver to identify what type of jellyfish that stings them. So
I
that's
see.
why we just give this recommendation, because box jellyfish stings, it can cause death, especially in the pediatric patients. For other type of jellyfish stings, sometimes it is not severe enough to cause death, but because the divers sometimes they have difficulties to recognize the type of box jellyfish. So the tip is to actually to use vinegar for all types of jellyfish stings.
Which
So
is a picture of the box jellyfish?
right, so both of it is a box jellyfish.
Oh,
So
both of it.
yeah, so in the center is a chironex, or what we call as a multi-tentacle
Okay.
box jellyfish. So if you see that it has a lot of tentacles, right?
Yes.
And this tentacle can go up to 1.5 meters.
Oh my
So it's
God.
very long, yeah. And then the pictures on the right side, we call it as a charoidite type of box jellyfish, or a single tentacle jellyfish, because for each corner it has only one tentacle. So this box jellyfish usually is very small. Sometimes the divers don't even see the jellyfish, but they just feel that something stings them. That's all. Right. So just remember that what vinegar do is that when you are being stung by the jellyfish, along the tentacle, they have the stinging cells that we call as cnidocyte. So that cnidocyte, upon any mechanical simulation, it will discharge venom inside your body. So what vinegar did is actually to stabilize the cnidocyte to prevent it from firing venom into your body.
I
So
see.
that's why it's not the treatment. So even if you're being stung by the jellyfish, even you have applied your vinegar, you need to go to the hospital to get an assessment by a trained medical doctors.
Is there what you call an antidote?
Right. So we only have antidote for one species, which is box jellyfish antivenom by Australia. But basically, it is used to treat envenomation because of the box jellyfish called Chironex fleckeri. But based on the experimental study, most of our box multi-tentacle box jellyfish in our Malaysia country is belongs to what we call as a Chironex Yamaguchi. But based on the in vitro studies, it can be used to neutralize the venoms. But if you ask me, for me that there is not really much study to say that the antivenom is superior. So this is actually different compared to the snakes. For
Yes,
snakes,
that's a
it's
question.
very proven. Yeah.
Okay.
But for the jellyfish antivenoms, there's a lot of questions about whether it really works or
Yeah.
not. But for me, my stand is simple. If the patient needs it, although that even for me myself, even though that I'm not a true believer of the box jellyfish antivenom, but if the patient needs the antivenom, it will be unethical to withhold the antivenom if you have it.
So it is not a foolproof treatment, but it has worked before, I'm sure, because if there is a debate whether
Yeah.
yes.
And the thing is that it also did not work for other type of box jellyfish, like the one with the single tentacles. But
Wait,
yeah.
I want to ask you, how readily available are all these antivenom?
It is not widely available in other part of the countries, but in Sabah, so far we have 3 hospitals that keeps box jellyfish antivenom, which is the Hospital Likas in Kota Kinabalu.
Mhm.
We have a supply in the Hospital Tawau, and in my hospital, Hospital Lahad Datu, we also have the antivenom. It's because that in my place in Lahad Datu, we have a lot of cases involving the box jellyfish stings, and we even have one patient died from box jellyfish stings last few years. So that's why our hospital keep the box jellyfish antivenoms.
I see. So now the question about this the sea snake antivenom, is that more
Right.
readily available?
Yes, sea snakes are available in all hospital that is located in the coastal area.
I see. Okay.
But usually most of the hospital they only store one box antivenom, because one box one sea snake antivenom, because one sea snake antivenom is expensive. If I'm not mistaken, so like I think it's more than 20,000 now, the price for one vial.
One vial of
Yeah,
antivenom is 20,000.
for the snakes. Yeah, for the sea snakes. So that's why most of the time, most of the hospital at the east coast that is nearby the coastal area, they keep only one box. Then if the patient needs more than that, usually we will mobilize from the nearby hospital.
Oh, I see.
Yeah.
Okay. Okay, we will take the question from Dokwiti later, yeah? Okay,
Right.
we go on.
Right. So basically, we have groups of people that you can actually consult if you are dealing with the diving emergency or marine envenomation. So the first group we actually have actually this is our special interest groups. We have the dive and marine emergencies. So the status currently it is an informal groups, but we have dive physicians and also doctors with special interest in diving medicines. So currently the one that is coordinating this group is my good friend, which is Dr. Elise. Dr. Elise is also a cave diver. So you can save the phone numbers if you are dealing with any dive emergencies and you need consultation. You can actually give her a call.
Okay, I
And
the number
yeah,
012-9242-041. What is where is she based?
she's now currently based in Selangor. But in our teams, we have doctors from all other states as well. So basically, if we have a cases that we think that need discussion, usually we discuss in the groups.
Okay.
So the things, and then the next thing is that this is the what our group are trying to establish, which is the Wilderness and also Offshore Medicine Society, or WAMS. So we are basically a groups of doctors, consist of the emergency physicians and also paramedics, but we are trying to recruit more people, including cardiologists also. We are trying to promote safety in the outdoors by providing trainings and also informal consultations if you have any emergencies in the wilderness setting, including during the diving emergencies. And the last group was the Remote Information Consultation Services ASEAN. So this group is a group of consultants that basically you can contact them every day and even at any time that you want if you have the cases. So basically, it initially started by the Malaysian Society on Toxinology, but now we are collaborating with the other toxinology groups from the ASEAN countries. So for the any cases involving the marine animal bites, stings, or even poisoning, you can actually consult the REX.
Okay. Wow. So you are involved in all.
I'm not a REC consultant, but I'm the committee member for the Malaysian Society on Toxinology. because for you to become the right consultant, basically you have to become a specialist first. So mine one, I still haven't finished with my training.
Yes,
So
but you
yeah,
taken your exam. When will you know the result?
it will be somewhere around mid of July. Yeah,
Okay, all the
hopefully.
best. All the best to you. And
Thank
then
you.
the other thing is, this wilderness is the one that you are really interested in.
Yes, that's correct.
And this wilderness will cover what?
Wilderness. Now we are even doing the wilderness first aid. We also provide medical standby
So
for
it will
activities in
cover
wilderness.
jungle, high
Yes, high altitude.
altitude.
Yes, correct.
Oh, I see. I'm going to Nepal, in October to do a summit climb.
Yeah. One of our consultant, which is Dr. Azamani. His research is mainly on the high altitude medicines.
Oh, I see it.
Yeah, so we have a mixture of expertise, including the jungle medicines, underwater, and
So like, for example, all the soldiers, askar, they have to go into the jungle, right? Do they?
so right. So jungles, actually for the army,
Yeah.
they have their own doctors, they have their own college for these things, and usually they will go training. They call it as it's a tactical combat casualty care. So through that courses, they will actually learn on how to manage emergencies in the during the missions. And they also even have in army, they even have a consultant, they have the surgeons, they have the anesthetists, they have emergency physicians in their teams.
Okay, so this team is all basically for, let's say, trauma, for
Yeah, this one is more for the
combat,
civilians.
and all sorts lah.
Yeah, for the combat injuries, we do learn, but we do not disturb their business lah, because army itself, they have their own hierarchy, they have their own system.
Yes.
So for civilians, it is not appropriate for us to like interfere with their management things.
Yeah. Okay, we understand.
Right.
Okay. So any more? Okay, go on. Any more?
Right. I just have a few slides. But this is just for awareness. So the problem is that as I told you before, right? Whenever there's an emergency cases or death occur, we always blame the cause of death as drowning. Why? One of the reasons that we never have a proper methods or proper channel or how we want to investigate diving emergencies. So by right, that when a diver dies, we have to look at their dive comms. We have to look at their BCD. We have to inspect the oxygen tank, and we need to conduct inquiry with the dive instructor or dive center. But until now, that we do not have SOP in place. But I really hope that maybe in the future that we can have this standardized SOP to investigate any diving related incidents in the futures.
I see, like a post-mortem, right?
Yeah, we have the postmortems, but the problem is that it's very difficult for you to determine the cause of death during the postmortem
Because they're already
without.
drowned, basically.
Yes, yeah, correct. That's why we need the SOP to investigate the cause of death in the divers.
Okay.
Yeah, the next thing, just want to highlight this, just a campaign that it is time that we need to actually make sure that our diving industry is more professional in order to keep our divers safe. Last month we have incidents of really things that being unwanted incidents in which that a diver been harassed by the dive
Right?
masters. Yeah. So our groups, the WAMs, you can go to our Facebook groups. We do post some advisors or some knowledge regarding the any things related to wilderness activities there. And yeah, and I think this is my final slide. to keep you alive during the divings. These 10 skills very important. I do not want to touch in details about all of them. You can have a look at my slides later.
Yeah.
So basically, that's the ends of my talks. Just to share with you this from my last divings for a few years back. Yeah, I think one thing that I really enjoy with divings is taking the underwater macro photography.
Oh,
So
I really enjoy spotting them. Yeah, I
yeah,
enjoy spotting them. I'm not good at I'm a a rookie, but
right.
yeah, but I really I was just telling somebody that I
Right.
want to do marine biology.
Oh yeah, I have the same concept, you know. If I have extra money later, I want to do maybe my master PhD
Oh,
in
I
the
was
marine
already
biology.
studying for PhD in nudity branch. I tell you, I love
Yeah,
nudity branch so much.
right.
Oh my
Right.
God, it's so many different types. Okay, we will answer Dr.
Right.
Raymond's question. How
Right.
fast is the ascent which is regarded as safe when we ascend?
Right. This one I have to check back. I can't
I think it's
recall
10
the
meter.
figure.
No, because I'm now studying for my dive master. It's 10 meter per minute.
Yeah.
30 feet per minute. So you cannot go up too fast.
Yes.
And you cannot go down too fast, but going up too fast is very dangerous, especially if you have done the deep dive. And
Thank
also
you, Dr. Betty.
no, but I cheated because I checked the Google before
Okay, okay. No, because
Yes.
nowadays I'm using the DiveCom, so I really not remembering the figure
That's
anymore.
right. And then I am because I just now reading my dive master book, so I kind of
Yeah, that's good. That's good.
I'm trying to dive more, climb more. That's why I love outdoors lah. So thank you very much. It's been got a few points that really new to me. The vinegar I know, but I didn't know that there's anti-venom, and then that sea snake can be so
Yeah,
toxic also. Yeah,
very expensive.
very expensive. Yes. Thank you very much. So we will stop the live streaming. We do not have a CPD point this week, next week, and maybe the next week. Oh my God, I feel so ashamed. But we will see what we can do. Okay. So Naeem, I see you on Facebook.
Right. Thank
We
you
wish
for
best
the
of luck
collaboration again.
Yeah.
Right.
We wish you all the best for your exam.
Thank you.
And then I hope to meet you you're based in Tawau or Sempunna?
Currently working in the Lahad Datu.
Oh yeah, Lahad Datu.
Yeah.
The notorious place. No,
It's
Adira.
a,
No more.
it's a very fun place actually.
No more pirates, Adira.
No, I hope so.
Are you a Sabahan? Are you a Sabahan?
No, actually I'm Kelantanese, but I've been working in Sabah for 12 years. I think I just fall in love with the place.
Yeah, I know.
And yeah, that because my special interest in wilderness, so that's why thinking of like still staying there. But
Okay.
if you want to dive in Lahad Datu, we have a one shipwreck, which is quite interesting, because if you want to do a shipwreck dive, most of the time it's very deep, 40 meters, 50 meters. But our shipwrecks is only like the maximum depth is only 22 meters.
Oh,
So you still can see a very intact structures that you can dive there.
okay. I try.
Right.
Okay, wait, hold on. I stop recording first.